Yeah, and my talk today is about the self-care of a heart, include like a heart like tightness or chest pain. The reason why I talk about this because they are, according to the record, they are 1/4 of the population in this country has been experienced the chest pain because the reason why it's so popular because the chest pain can caused by heart problem like a real heart problem like a coronary heart the artery blockage or even the valve problem or even the stress or chest wall problem as well. So I will leave this job for your doctor to make your diagnosis, and my job here is to teach you how to take care of yourself. And a couple weeks ago, someone's mom was hospitalized. She was in hospital for overnight because when she cleaned her window, all of a sudden she feels like a chest pain on her left, and it was sharp pain. And she feel like she has to sit down, and the pain's still there, and she even has some like a sweaty, and she said we need to call 911, and the ambulance take her to hospital, and turns out her heart was good, and they finally give her a diagnosis of stress related. So emotional distress can cause the chest pain as well. And I have another patient, and she has originally she feels she doesn't have much chest pain, but the tightness, heaviness in her left side, and feels really low energy. Then she went to hospital, and the doctor said you're the branch of the coronary artery, one of the branch has been blocked by 90%. So they put her on one stent immediately. And after that, she still feels her energy has been better, but her tightness chest is still there. So she back to the hospital say, what I'm gonna do with my chest is still in pain. So doctor say, hey, you're okay, and so just keep your eye on and taking pills. So if you have anything happen, give us a call and take care of yourself. She asked me, how can I take care of myself? I don't want to have a chest pain. So today I'm going to teach you guys how to take care of your own heart, own chest pain. And first of all, I will teach one point massage, just massage your heart. And massage can improve your capillary circulation on your heart. This is what I do. You guys sit here and follow me. I'm sorry, I bother you much. Put your left hand, let me take this out. Left hand under your breast. Okay, make sure here, touch your rib. And the right hand on your top of your breast. You're too high. Yes. Your top is too high. Lower. Yes. She's good. She always good. And yes. Now I like to massage, give yourself a little bit pressure, 1, 2, 3. I counted 50. I want you guys to give yourself a little bit pressure, and
with breathing.
I'm not only your left side. All together count to 50. and like 1 second you count 1. So you're not massage on your breast, you're massage on your rib. Like 1, give yourself a little bit press, 2, 3, until you finish your 50. And if you can do this once a day, at least, if you can do twice a day, that's fine. Like at least before you sleep, and that help. And so at least make you like improve your microcirculation in this area a little bit. Okay, we're gonna do the second. And there's a doctor, and he read an article, it's really interesting. One day he was in a wedding party, and they were 70-year-old gentleman sit next to him, almost passed out. Like he said, oh, I have a chest pain, then he cannot talk anymore. Like it is pass out. And the people started calling 911. You know, it takes a while, the ambulance comes. Then what he did, he is a doctor. He started to hold on this gentleman's arm. This is elbow, right? And start to tap, do this. Really hard. You just need 1 layer. You need a layer. You need 1 layer. Okay, do this. Like he has, because you can stop. Because that gentleman already passed out, he asked another person to tap the other side, and until the ambulance comes. And turns out this patient been diagnosed with a coronary like a heart attack, and but they saved his life. They said, who did this? They said someone in this party, and said, wow, it's doing good, like saved, like improved his heart circulation a lot. I tell you why we do here. From this, this is acupuncture meridian, right? And this is your heart meridian. Your heart meridian is from here, go down to your your wrist, and so goes through here, right? Your elbow, inside of your elbow. And here's another one called like a pericardial, goes through here in the center. So 2 like meridians related with the heart go through here. That's why your elbow, inside of your elbows is important for save your like heart, to improve your heart circulation. And if you do this, tap your heart and the pericardial like a meridian, some people can see the purple become purple. If you see purple after this, after my tap, I can see there's red, and because I tap really hard. You need 1 layer. You need 1 layer, and if it's really purple after you tap, because you tap really hard, right? And that means you really have some heart problem. It can be a self-diagnosis.
I don't understand. If you
like after you tap your left elbow, these 2 like meridians, you're supposed to be just reddish only, right? Like me,
okay.
Like this.
Well,
okay.
If it's purple.
If you look like a purple, like a bruise over here, you have a blood stagnation. You have to check with your doctors, see if you have a real heart problem, like see how your heart circulation is. So this is good, for emergency. It's better than you do this like a push, because it's safe. And if you can do yourself 50 times a day, you can improve your own circulation a lot.
Just on your left
No,
arm?
both.
Oh, both. Okay.
Well, 50 each.
50 each. Okay.
Right. We were talking about the 50. 1 second you count one.
Okay.
Not that one. Not that
Right.
like a 1 second one.
Okay.
Okay. So this is a good treatment and a good diagnosis. And if you feel it's painful, you don't have to do this. You can just massage on this meridian or point. Someone, I give you a alternative point for this if you don't want to do this, okay? And from the your elbow, I'll show later on. I'll show from here, from your elbow line to your wrist line. We count it like 12 inches. In Chinese, we call it 12 sun. So in the middle is a 6, right? And you go 1 inch down. That is the point. This is a pericardial point. You can massage this like clockwise or the 25 times, counterclockwise 25 times. If you can do this, it can be your alternative treatment than this one. But I teach you this one in case someone really has a problem, like when you're waiting for the ambulance, 911, you can do this. Or occasionally you can give yourself this kind of treatment. So this point is over here. And according to the textbook, they said 5 inches above the like a rest line. How can you find the 5 inches? Difficult. So normally I just count this elbow line. In between elbow line and rest line is 12 inches. And in between is 6 inches. I have a 1 inch down is 5. That's the point. You can massage yourself every day. And so far we had 2, like a massage of your heart and do the